Easy signs that will point you in the direction of pelvic floor dysfunctions that you should know about is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. There's so many subtle signs to pelvic floor dysfunction that I absolutely wish my patients and the general public would know about. For instance, the dead giveaway is if you have a poor posture. If you have a poor posture, you do have some degree of pelvic floor dysfunction. We're not talking about poor posture just in the lower part of yourself. Everything above is sitting on this pelvis. The way you walk, the attachments of your legs to your pelvis are influencing your pelvic floor and therefore any dysfunction. So any chronic lower back pain, any chronic pelvis pain, sacroiliac pain, the joints in the back part of your pelvis, pain in the tailbone, issues with the way you walk. So it could be your ankles, your knees, your hips. It could be that you have tight inner part of your legs, which is very common. Restricted ankle mobility, very common in people who sit behind the desk. All of these contribute to pelvic floor dysfunction. Pelvic floor dysfunction is not just in the form of incontinence. And that's the mistake we make. We're like, okay, well, I'm not leaking, so I don't have pelvic floor dysfunction. Pelvic floor dysfunction is the name of a book. Incontinence is only one chapter of this book. So all those chronic things that I told you about with the posture being not proper, improper breathing plays a huge role, and you don't probably even know what improper breathing is. So I'm going to make sure I put a video at the end of this video so you can check it out and see how you should be breathing. It's so ridiculous that we even have to think about it, but we've become so dysfunctional in the way we live, in the way we carry ourselves, that we're breathing, but we're not breathing effectively. Of course, if there is a history of trauma to the pelvis or areas associated to the pelvis, are a dead giveaway. There is any issues with like painful intercourse, testicular pain, pain with erection or after erection. These are all things that obviously point to pelvic floor dysfunction. So stop thinking pelvic floor dysfunction means incontinence, and since you don't have it, then you are good. The other thing that I'd like to remind you of is that there are medications that cause incontinence. So that does not necessarily mean you have pelvic floor dysfunction. There are conditions, neurological conditions, like multiple sclerosis as an example, that cause general weakness in the musculature. So you have weakness every place, including your pelvic floor. So should you just say, well, I've got multiple sclerosis, so I guess I'm doomed? Not necessarily. Because if you give up, you're only going to get weaker in every part of you. So if I were to focus on what would be the biggest thing for everyone to look at, is scrutinize your own posture. We're not talking about what's pretty and what's not. We're talking about functional mobility here. I have done a video on how to assess yourself for functionality of your movement in a different channel that I have. So I'll make sure that I put that at the end of this channel as well, in case you want to check it out. Explore the blogs I have on my website. Make sure you subscribe to this channel. And if you have any questions, contact the office. I will talk to you on the phone first, just to make sure this is the right fit for what's going on with you. And if it's not, I will at least point you in the right direction if that's applicable. Thanks for watching.